The purpose of this training here today is to provide the right training in combat casualty care for the canines towards handlers as well as the human providers that could see them downrange. So it is important for troops to understand this because dogs, just like the humans, are that frontline fighter. So many times when they are injured on the battlefield, they need to receive the same care, and there are some subtle differences between the dogs and the humans, so we're trying to increase the fighting force for the veterinary corps.
So when military working dogs are deployed with their handlers downrange, there are no veterinary personnel at the point of injury or even at the battalion aid station, such as the Roll 1s. So our job is to train our handlers as well as healthcare providers, medics, corpsmen, flight medics, nurses, even docs on how to do the initial stabilization on military working dogs. The method that we do that is the M2 Arch 3 algorithm, which is muzzle, control massive hemorrhage, stabilize the airway, respiratory control, and then restore circulation, check for hypothermia, hyperthermia, as well as head trauma. And then we make sure that they administer any pain medications, antibiotics, wound care, as well as sedation for the dog.
The training aids we're using are diesel canine training aids. So they have 15 different medical capabilities. They basically are a 6-8 Whiskeys equivalent of their training aid they use in their best medic competitions or in the schoolhouse. This is the veterinary version of that. So Diesel breathes, bleeds, he has guts hanging out, you can intubate him, place catheters, and do some life-saving measures. So right now, no, we're not at a high op-tempo deployment, and we're not having a lot of dogs injured in a deployed setting. But there was a time where we were. There was a time where maybe they would have better care if there was someone who knew what they were doing at that point of injury.
Hey, thanks for watching this video. For more content from U.S. Army, check out our other videos and subscribe to our channel.